going to wait for a few minutes for everyone to join. And my name is Aleksandra, and I'm one of the organizers of the Minds Conference. Nice to meet you all. And Linda will be your session chair for this session. So we'll pass the word to her to continue the introductions.
Linda joined, yeah, okay, cool.
And Olga will be the speaker. If you can type in the chat where you're joining from, that would be great. Ooh, Australia, Switzerland, Germany, Austria, Denmark,
Italy,
Mexico, whoa, UK, India, amazing.
Hong Kong, Netherlands. Oh. Egypt, this is amazing. Natasha, will you give some introduction or not really? Like, how does it work now?
Yeah, so Linda gonna introduce with the opening remarks, and then the session chair will introduce the speaker, and we'll move on to that. So we have 5 minutes to do that, so you can start on time the session. Linda, are you ready?
Yes, sorry about that.
No worries. A little technical difficulties as usual.
All the technical issues, of course. So I guess I will start. Welcome everybody to the Minds Conference. So my name is Linda Corcoran, and I will be the chair for, or one of the chairs for the Central European Time Zone. On behalf of the Organizing Committee and Dragonfly Mental Health, I would like to welcome you and thank you for joining me for this block of the Minds Conference. If you are not aware, there is 2 more blocks after this that you can also catch. If there are some great similar programming, but slightly different. So if you want to catch that too, you are welcome to do it. So the Minds Conference, if you don't know, was created by a group of graduate students, postdocs, and professionals from different backgrounds who are all passionate about mental health in academia and creating a space to have these conversations. None of this would have been possible without our amazing organizing team, who consist of over 30 people, and also support of the Minds partner, Dragonfly Mental Health. Please don't forget that you can support Dragonfly Mental Health through donations on their website. And a special thanks to our other partners, PhD Balance, Voices of Academia, Cactus Foundation, Center for Innovation in Campus Mental Health, and IMS International for spreading the word about this great initiative. We also wish to acknowledge that some people who are joining us today are occupying traditional Indigenous lands, and we would like to acknowledge and express our gratitude for these lands that you all live and work on, no matter where you are joining from today. In this time zone, we have an exciting program which includes an amazing workshop on imposter syndrome, which is going to start in a couple of minutes, a panel on career and mental health stories, a round table on how we can start advocating for mental health in academia, and a discussion on overcoming workplace bullying and power abuse in academia. So we hope that you enjoy this session and connect with speakers and other attendees. If you have any questions or any comments, feel free to put them in the chat. We have IT and moderating, and we will try and help you out if you get into any trouble and can't hear us. We are also live streaming this on YouTube. So if for any reason your Zoom is not working, you can also catch it there. So I guess to move on to our session. This is our workshop on imposter syndrome. This session is going to be starting presently. I guess we will start from now. And thanks so much to the amazing Olga from Dragonfly Mental Health, who is going to be presenting. So before I pass the virtual mic on to Olga, just to get some housekeeping out of the way, feel free to turn your video on, but please keep your microphone muted while speakers are presenting. We've enabled closed captioning. You may turn it on or off by clicking the arrow next to the live transcript button at the bottom panel of your Zoom window and selecting hide subtitle or show subtitle. In the event of someone hacking into the Zoom session, we will either remove the responsible parties from the meeting or end the meeting. If the meeting is ended, please check the email inbox with the email that you registered for further instructions. We will be recording and streaming the sessions, as I already said, but we will be stopping the recording for the last 10 minutes or so. If you would like to ask questions yourself and not be recorded, you can do so then. We will let you know before we end the recording, and we want to also provide trigger warnings as sensitive subjects may be discussed. If the topics of these trigger warnings may be upsetting to you, please use your own discretion about attending or not. You can come back when you feel like, and if you need to step away, please feel free to do that. That being said, we are not mental health professionals here, and this is not an event that should be taken in the place of counseling or therapy. And you can visit the website mindsinacademia.com/resources to refer to collected resources by our partners. Please remain respectful of others. Inappropriate behavior or comments will not be tolerated and may result in your removal from the conference. And if you need help during the session, please contact IT in the Zoom meeting or email minds.conference@gmail.com. You may enter questions in the chat, and I or the moderator, as relevant, will read them to the speakers. Please feel free to send your questions directly to me if you wish to remain anonymous. And with that, I would like to welcome our speaker today, Olga from Dragonfly Mental Health. Thank you, and the virtual stage is yours.
Thank you so much, Linda. And thank you so much, Sasha and other organizers. I'm really grateful to actually open the European session. I feel really honored. This is great. The only thing I have to warn you about is that I'll have to leave at around 9:45 local time. But Linda, Sasha, Andrea, and other people who are going to be there, and Simo also from Australian part of the world, there will still be people, and you'll be able to discuss and maybe have a discussion on your own, whether facilitated or not. So if you feel like asking the questions, you probably better write them to Linda, since I'm not sure. So I'll be able to finish the presentation, but I'm not sure if I'll have enough time to answer these questions. However, if you feel like, please always feel free to drop me an email or drop an email to Dragonfly and ask them to address it to me. You can find my email nearly everywhere online, or just I don't know, maybe someone can just post it in the chat just in case. Yeah, so I'm very open. Please feel free to drop me a line after the talk, or maybe a week after the talk, or 3 weeks after the talk, whatever you feel like. Today, I'm going to talk to you about the imposter syndrome. Some people call it imposter syndrome, some people call it imposter fear or imposter phenomenon. And the question is what we're going to discuss today, what is it and how to manage it. So a little bit about myself. I have obtained my MD from Moscow in 2012. I studied in the med school, and then I have written my MD. I worked on my MD thesis in the States, worked on traumatic brain injury, and then I have obtained my PhD in 2017 from Berlin, Humboldt University, working in cancer research. And then I was a postdoc at MPI CBG for the last 4 years, and have recently moved to Switzerland and continuing my path, or the current path, as a manager in some industry company. So I have been involved in organizing mental health initiatives. So we started with the Organizing Mental Health Initiative in my postdoc institute in MPI CBG in Dresden, Germany. And then the initiative grew, and we have organized the mental health collective of the whole Max Planck Society within Germany. And in 2019, we got Dragonfly Mental Health co-founded with other people. And in 2 years, or a little bit less, actually, 2 years, we've gotten like more than 8,000 academics reached with our lectures and workshops, more than 90 lectures, seminars and workshops given. We've got more than 250 volunteers. We're super grateful with the community response we're getting with our initiatives. As Linda has already mentioned, we're not healthcare providers, and I am not currently acting here as a healthcare provider. And the information provided today, it is not a medical advice. Our lecture is educational. And of course, this lecture doesn't substitute for speaking to medical professionals. So closer to the topic. The imposter syndrome is something which is being described as, it describes the high achieving individuals who, despite their objective success, fail to internalize their accomplishment, and they have persistent self-doubt and fear of being exposed as a fraud or imposter. So imposter syndrome, or imposter fear, or like perceived fraudulence, it's not yet been recognized as a psychiatric disorder. So that's why we always list the names, different names of this thing. And the first time it was described in 1978. And since then, there's been a reasonable amount of studies showing that around 30% of medical and pharmacy students have imposter syndrome, and from 20 to 60% of physicians and physicians in training have imposter syndrome. Now, it also seems like that depending on the tools, the screening tools and cutoff lines and the set of symptoms, there are different data showing from 10 to 80% of people having imposter syndrome in the population. And imposter syndrome is common among both men and women across the range of age groups. And it often is comorbid with depression and anxiety, and is associated with the impaired job performance, or especially job satisfaction, of course, and burnout among various employees. And there have not been published studies evaluating treatments. Today we're going to talk about the imposter syndrome experience in academia. And in general, the person who has imposter syndrome, despite the fact that they have numerous diplomas, assurances of their colleagues in their professionalism, or assurance of their bosses, and high positions, and they still don't believe in their merits. And people may believe that they have whatever they have, their success or seemingly success, that all this has been achieved by a happy coincidence or some circumstantial things, and not because of the talent, qualifications, or hard work. Person with imposter syndrome feels like they're driving others around, and they feel like they don't really understand the essence of their work in depth. And while imposter syndrome is not a medical diagnosis, it can still significantly ruin someone's life. Imposter syndrome, people with imposter syndrome, they may feel like they're constantly being negatively evaluated. And again, feeling that they find themselves at the point being there just by accident. So they may feel like, or they may have thoughts such as, when they find out the truth about me, they will definitely give up on me. And basically it goes with the story about the naked king. So the person with the imposter syndrome, they feel like they're this naked king, and people will definitely see that I am that naked king. And of course, this thought of I'm here by accident and the fear of follow-up revelation, it leads to the feeling of shame. And so when it comes to the self-esteem of these people, this self-esteem, it depends on the achievements they can demonstrate publicly. So therefore, the self-esteem is not fixed. And they have the feeling that I achieved something and therefore I have the right to be. Another experience which one may have is that they're given too much credit to others and not enough to themselves. So like not only, so for example, a PhD student may say something like, I could do nothing without the support of my postdoc. And in this case, of course, it's really essential to be able to try to evaluate what are your own achievements. Another thing is the presence of minimizing language from others and from self. So not only the person may think that, oh, properly trained monkey can do a PhD. It's not something which typically comes from the person. It's something which typically comes from the PIs or postdocs or whatever. So from the bosses or advisors. So we do hear a lot from different people that a properly trained monkey can do a PhD, and this is a minimizing language which provokes imposter syndrome. Another thing is that your boss may tell you something like, oh, is that all you have achieved since our last meeting? In minimizing language makes you think that you haven't really achieved anything, makes you minimize your own efforts and achievements. So this is something which can promote the imposter syndrome as well. Where is the imposter syndrome coming from? There are multiple theories, of course, and there's no like golden standard where it comes from. There are multiple factors. So for example, environmental and institutionalized discrimination may provoke imposter syndrome in certain people. Some personality traits, as we talked about, so anxiety, neuroticism, or it can be childhood and attitude experiences. So for example, in case of trauma in the childhood, the example is that the child value was determined by the parents, not by the fact of their existence, but through the prism of their achievements or the lack of the achievements. So it's important to underline that this trauma doesn't really have to come from the family, can also come from the environmental factors like school or university. But when it comes to the trauma of the child, that means that at the moment of their development, the child was perceived by significant either as an object of their own achievement or as an object that must constantly demonstrate these achievements. The child was noticed only when they were doing something, and this was evaluated by others. So for example, brought an A from the school, won a contest, earned $1 million. Or the child is constantly devalued by adults and gets used to the living in the world where they constantly in the shadows, where their achievements go unnoticed. In most of the cases, the child's basic value of being loved because of the existence is ignored. So no one tells this child, it is great that you are with us and you just exist. So in the end, the person grows up with the feeling that they have to reach as much as possible to be seen or loved, or to be seen and loved. So instead of, so the child may have experienced such things from their parents. So, oh, this is nice drawing, you're drawing a good technique. So like, we'll send you to the best drawing school where only talented kids go, and like you'll be the fanciest artist possible and become super rich and fancy. Or the child better should have been told something like, oh, did you like to draw? Did you enjoy the drawing? How pleasant I am that I have time, that you have time and desire to draw, and then we can do it together. So these two approaches, and one of them may trigger the imposter syndrome thoughts. When it comes to academia, other studies have already shown that there are around 20% of university students suffer from imposter syndrome. Other studies, which was recent, I think maybe a couple of months ago, published that there are up to 95% of females experience moderate or severe imposter syndrome. So in academia, and this is, I believe, is very important part of this talk, is that I would like to bring up that academia strives for imposter syndrome. Academia really imposes the imposter syndrome on us and makes us feel bad about our own achievements. So we would work weekends, Christmas time, and guilt trip ourselves to work better and longer. So it comes from the academic achievements in school and university. And for example, so one can feel like they have the best grades in the school, and now they're the most stupid person in the university. Constant comparison of research achievements, often promoted by the environment in academia, of course, when the young PhD student or the PhD student who has just started thinks, oh, my peers have already published so much. Or it comes from the environment when the PI is telling all my PhD students have to graduate with the top journal paper. So these are sometimes unrealistic expectations imposed on the students, but they do promote imposter syndrome. Another thing is that there's constant comparison of efforts put. For example, we hear often that, oh, my other PhD students, they work during the weekends. So that makes us feel bad that we don't work over the weekends, which is crazy, but this exists. Sudden unsuccessful events on academic paths. So things may go great, and then suddenly, like, you get destroyed by the supervisors during your defense, and you may barely pass. So this happened to me. And yeah, I was completely knocked out for a week. I was constantly crying after I got my preliminary result for the, I mean, this is something which really like triggers your imposter syndrome. Another thing which causes imposter syndrome or like triggers it is the financial instability compared to the peers who did not choose academic paths, especially when it's brought up to us by our families. So when the mother may say something like, oh, your former classmates are already providing for their families and they're married and have children, and you still don't have your PhD and you're already 30, and so on and so forth. So if you evaluate yourself through achievements, and the problem is that in academia, this is the success criteria. So the success criteria are the amount of talk given, the invited talks, the presentations, the publications, and so forth. So something quantifiable. So if you evaluate yourself through this, you will feel that you don't have a solid fundament for your self-esteem, and each and every failure would really knock you off. And the problem is that failure in academia is the part of the job as well. And of course, we have to also acknowledge that marginalized classes with the diversity of experiences, they really have their imposter syndrome imposed on them with a much higher intensity. So women are often told, oh, you're too pretty to be a scientist, or you should have been modeling instead of being scientist, or physics is not a job, like not a field for females, something like this. People of color, on top of facing racism and discrimination, are constantly taken and approached by as janitorial staff, and people constantly minimize them. Then LGBTQ folks are also experiencing marginalization and homophobia, and they're constantly told something like, your outfit is not appropriate enough, it's not good enough for academia. There's been a case when a person during their PhD, they were too scared to do the transition, and they were scared because they thought that their PhD committee would not accept it, so they were waiting for the defense to start the transition. Again, economic challenges is something we have discussed already today. The disability folks face ableism, and also the academic environment in a lot of cases is not really prepared or not wanting to prepare, say, no, you know, we only have got one person with the visual impairment, so we're not going to adapt the whole program for just one person. So of course the people will may feel that they don't belong, and the imposter syndrome flourishes on such environments. And then, of course, international scientists, they experience cultural differences and language barriers, and they may be mistreated because of the language barriers, and you may feel like you're missing something out. So this is something which, and in general, the imposter syndrome, it threatens the diversity, and actually it may potentially explain the higher drop out rate among marginalized groups in academia. What else is there? So basically, the problem is that with the imposter syndrome, one has the constant basic background anxiety. As we talked already today, at the closer examination, it turns out to be a fear of shame, fear of being exposed, and the shame of not belonging to where you are. And the imposter, actually, in fact, they always feel like they feel like everyone else knows how to live or how to do their work, but the imposter doesn't know, so they just pretend. And so they actually like are really good at hiding it. So the person with the imposter syndrome communicates, like live their life, smile, have the conversation, and like manages, but they still feel like they're constantly missing some knowledge or some important skill. And if people figure it out at a certain point, something terrible will happen. So basically, according to the studies, most of us in the academic crowd feels like everyone seems to know what they're doing, and I don't know what's going on. What is this terrible that people are afraid of? So the fear of exile is especially impactful for immigrants. Like we may feel that, oh, my contract will be terminated and I'll have to go back home without a degree, which is embarrassing. It's a huge shame, and like I'll have difficulties dealing with my family, friends, and you know, I will not be accepted here, and I will not be accepted fully there. Yeah, so, and this anxiety can disguise in the great fatigue, procrastination, or even can be tried to cover by the substance abuse. And person in academia with imposter syndrome, they have the constant desire to receive the confirmation that the person is really where they're supposed to be, or they have the right to be there. So this is the desire, which is supposed to be supported by someone else who is from outside. And the problem with that, so when the people think that, so they feel like instead of thinking I'm fine, I'm a normal person who has different days, like some good, some bad, they constantly feel that, or if I become perfect, then no one will be able to pick on me, no one will be able to, like, you know, bully me or something like this. And the problem with such a feeling is that this feeling can never be saturated, and most of us have experienced that. So when you receive, finally, you work hard and you receive such a positive evaluation from your peers or from your boss, you feel relieved for the first 20-30 minutes, but then you're like, oh my God, I tricked them so well, but what if they figure out that I'm actually stupid? So this is something which comes from the belief that one can actually become ideal, which is not really the case, most likely. And so when we're told, oh, you're doing great, we still feel like, oh, they say so because they feel sorry for me or because I treat them well. Or something like, oh, they're distracting me, but in fact, they're already looking for someone else to substitute me. And again, the danger of this thought, and in general, the imposter syndrome, as well as of any other neurosis, is in the reduction of the life quality. And the person's life is never as pleasant or as full as it could be. And when the PhD students in training were asked about their imposter syndrome, they have identified multiple things where they have, where they think their imposter syndrome comes from and where they're experiencing particular difficulties. So one was the progress and public recognition, which they lacked. Too much of comparing oneself to other. They felt like they need to develop certain skills, or the skills that are not really developed, such as public speaking and scientific writing, that they need better options to apply for the new knowledge, and that they don't know how to ask for help. And unfortunately, it's been shown that students of all stages of training felt like imposters. What to do? First and the foremost is it's important to notice and accept that one has an imposter syndrome. Fighting, per se, like fighting imposter syndrome can be non-productive, because fighting imposter syndrome equals to an improving person, to an improving of a person by deciding that they're not good enough. And they already have a constant suspicion about this anyway, so fighting imposter syndrome is like counterproductive. So what helps is psychotherapy. It's a long-term, it's non-linear, there are more and a lot of back and forth steps, but this is something which is suggested for people who suffer from imposter syndrome. Again, you have to be careful that with the coaching, because coaching sometimes offers some short-term solutions, something like, oh, I'll learn something fast and then I'll become better. And this is again the trap of not being good enough. What to do? So another thing is that when you're trying to, or when you're thinking of learning something, you should really think of what is the reason for a person to learn something. So one thing is if you want to learn how to write grants, and another thing that it can be turned into a meaningless perfectionism or striving to prove something to someone, such as, if I don't write perfect grants, I'll not be considered a perfect scientist. So I'll go learn now, and it doesn't matter that I actually hate writing grants and I love teaching students. I'll still write, like, do the full training in writing grants, because that will make me a better scientist. Another thing is that there are like different approaches that are applied during the therapy, or like, I don't know, reading the books about this. So what they're saying is that in general, the approach should be aiming to meet the person's personality. So the patient learns to identify their own feelings, because they've been suppressing their own needs since the very childhood in case of childhood trauma. So the first stage would be defining one's emotion. Another next stage would be defining this, identifying the needs behind these emotions. And the third one will be orientation, what the person exactly wants to do. One thing which one can do right away, and I strongly encourage it if you feel that you are trusting your peers enough, is that try to talk to your peers about the fact that you may have imposter syndrome, and you'll figure out that there's so many people who live with the same idea of them not being imperfect, or struggling from them not being perfect. And especially in academia, the rates of imposters are super high. Try to use the principle of sufficiency, so which is opposite to principle of ideality. So the feeling of sufficiency is something which is important, and it actually may gradually heal the imposter syndrome. So try to tell yourself that I am and I can be sufficient, and I am sufficient to do my job. Yes, I do have some skills I don't have. Sometimes some skills I will gain, some skills I will lose. And somewhere I'll be better and somewhere I'll be worse than others, but this is normal human being, and this is fine. And I strongly encourage team leads to promote this in their teams each and every time, telling that you're so lucky that you have such a diverse team and that everyone brings something to their table. And the ways to cope with imposter syndrome, as we have talked already, basically know the signs and symptoms, try to find out and internalize the fact that you're not alone, that try to recognize and underline to yourself each and every time that you have earned the position where you are at. Try to stop comparing yourself and your work to others. Try to learn how to accept congratulations of your own achievements and learn how to deal with your own perfectionism. Try to be kind to yourself. Try to track your success. Talk to your mentor or PI if you trust them enough. Try therapy and embrace the feeling. This is my last slide for today, and I still have like 5 minutes to discuss maybe some questions. I see that there's some messages on the chat, so I'm not sure if there are questions or just some.
There are some questions. Thank you so much for your presentation, Olga. Let me see if I can find them. I did see one. How can you have conversations about your feelings of imposter syndrome with senior work colleagues without sounding that you are really needy or just want reassurance?
That's a good question. And in this case, I would definitely suggest starting from peers. So, and then as peers, as a group, you can come up with a better suggestion, because I cannot give you a suggestion on particular PI. There are some PIs who are more understanding, some PIs who are less understanding. So I would definitely suggest you to start the brainstorm on how to address this conversation with your PI, with the peers. And, you know, most typically, if one person says something, may not trigger some thoughts in your PI, but if the whole community says this, there is a higher chance that that the PI will listen. Plus, again, you know, I think this whole word needy is something which is which has a negative connotation. And actually, I think that normal person who has intellectual, emotional intellect, they will not think in these terms. Like, you may feel like, oh my God, I'm an imposter, I don't know anything, I'm so needy. But people with emotional intelligence, that they will not feel this way or think this way about you. They will see, oh, okay, so my student actually has some limitations. How do I address this limitation in the way so that my student feels better? So this, I don't think that like everyone would right away feel that, like, you know, like we would judge them if they come to us and say, hi, I think I'm struggling from the imposter syndrome. So I really think that maybe this is something you are actually imposing on them. But again, it's better if you, of course, you double check with your peers.
Absolutely. And I think it's a little bit about vulnerability as well, and it may be on your part, and it may also be on whoever you're speaking to's part, in that they don't want to be vulnerable either, so they're just saying it doesn't exist, even though they probably have imposter syndrome as well. There was another question here, and oh, I'm going to butcher this. Do you think Aleksandra, I know what it is.
Alexithymia, it's a difficulty of defining your own emotions, is connected with imposter syndrome. So causation, correlation question is a big thing here, of course. And so alexithymia can come from multiple things, but definitely, as we have discussed, experiencing difficulties of your emotions may actually prevent you from trying to figure out what you enjoy, what you don't enjoy, especially when it comes to studies and research fields, because it's like, I don't know, also very similar or goes along the A grader syndrome, you know, like you are good at most of the things, so you don't know what actually you like or not. And then of course you go along till the time you're getting your PhD and suddenly you're still not happy. Yeah, so I can imagine that this can be connected with the imposter syndrome, but again, it's hard for me to say which is the initial where it comes from. This is like something which therapists usually deal with.
Absolutely. We are getting a lot of comments of people saying, you know, what has worked for them.
Oh, thank you so much. This is so nice of you guys.
Yeah, I think it's great to see what has worked for other people because it is so common. Someone says, I find it much easier providing reassurance and support to colleagues who express some type of imposter syndrome rather than trying to deal with my own. I guess this is common.
Oh yeah, like it goes along again with Sasha's question. If I'm wondering if empathy can be tricked to be used internally. This is a very good question, and I can imagine, like, I've been struggling with this for so long, you cannot imagine. I'm like, why am I harsher on myself than on other people? Like, why am willing to forgive other people for something which I would not forgive myself for? And this is the discussion I've been having with myself. And actually, I'm like, okay, maybe I should be less harsh on myself. No, this is human. I am just a human. I am not perfect. I'll never be perfect. I'm a human being. And this is something which does help me. But again, this is something with which one has to deal with a therapist on a longer run, I guess. And yes, it is much common to help others. I mean, because you see others, like, you see that they're doing a lot of great work, that they're being great peers, that they're being great support for you. So you, of course, can assure them because you believe in it. And then when it comes to your own feelings, you find it difficult to believe in it, and that's why you're struggling. Okay, so people, it was wonderful. I'm, okay, my sister says that there should be some question. I'm trying to find it.
There was
can you forward the question to me? I'm a bit confused. Okay, here it is. I'm afraid there is a risk of confusion imposter syndrome with a situation when you're really not particularly good at this area and it's time to leave academia and try something else. Yes, there. I mean, there is a risk, but this is the essence of the imposter syndrome. Like, what do you mean you're not good? Didn't you have your high school diploma? Didn't you have your bachelor degree? Didn't you have your master degree? Like all these, like, objective achievements. These are the essence why you are in academia. Then you need to figure out why are you actually thinking of leaving academia, because you think you're not good at it or because you're not enjoying it. And this is something where you need to figure out this is something no one can actually like can tell you the solution for this question, but I would definitely recommend therapy if especially if you are in Europe, then you can probably get it covered by insurance. And this is something which, yeah, this is a very good question. And I think all 52 of us here, we think about it once in a while. And some of us decide to leave academia because they're not enjoying it or because they feel they're not good enough or whatever. But yeah, like it's a question of a personal decision, and I don't think anyone can give you better understanding on this. It's on you, unfortunately. Okay, I have to leave now, but it's been a pleasure.
Yeah, thank you so much. Oh yeah.
Yeah, and thank you so much, everyone, for the wonderful chat. I have to run, but everyone still stays here and discusses.
Yeah.
Okay.
Absolutely.
So have a nice day, and yeah, thank you so much again for organizing this. This was wonderful.
Absolutely great. Thank you so much, Olga. If people still do have questions or they want to discuss parts of imposter syndrome, you can absolutely feel free to do that. We will be stopping the recording in a minute, so if people want to speak and not be recorded, you can feel free to do so then. We just need to record the outro. Sorry for the video session. So thank you all so much for attending this session on imposter syndrome. If you are interested, our next session is a panel, and it will be in a different Zoom link, and we'll be starting in 10 minutes. So if you are interested in it, please attend. Later on, we have a roundtable and a discussion. So also attend those if you would like to. Thank you so much for attending, and we will see you soon. Bye.